Hi, I'm LaShawn and I'm the co-chair for Needs Assessment, and we want to talk to you today, or I want to talk to you today really briefly about a survey that we did with the trans women of our community, as well as a little bit about SEMHAC, as well as our needs assessment. Okay, so we completed a survey for trans women living with HIV in the year of 2018-2019, and we're going to go over some of the results that we had. So just really quickly, SEMHAC's mission is coordinated regional response to HIV/AIDS in Southeastern Michigan. We do work with round white dollars. Round white dollars are funds of last resort. So a little bit about needs assessment. SEMHAC does ongoing needs assessments to better understand the people living with HIV in the DEMA, or the Detroit eligible metropolitan area. And the way that we do this, some of the methods include focus groups, interviews, and surveys. This survey in particular was focused on trans women. SEMHAC completed 11 interviews with trans women living with HIV in the years that I said, 2018 to 2019. We gathered info about barriers to care and other needs, including high rates of HIV infection, discrimination, and stigma. Findings can be used to plan HIV care services in the DEMA. So some of the women that we worked with first learned that they were living with HIV anywhere from 3 to 21 years ago. Most of them saw the doctor within, or were in care within the last 3 months, so that was awesome. Some of the issues that we found out, trans women interview issues are interrelated and complex. You'll be able to see the chart that mainly goes back to stigma, but it lists lots of things, including safety, employment, transportation, housing, healthcare, and mental health services. I want to talk a little bit, or go in detail a little bit about some of the more ones that stood out a little bit. So stigma and discrimination. Stigma and discrimination was one of the most consistent themes in the interviews. And this was experienced in employment, healthcare, housing, public safety, transportation, and other services, and also in daily life in the community. It affects safety, mental health, and just overall well-being. So I want to go into safety a little bit. Many experienced violence and were concerned about the effect of the community. Detroit is considered dangerous for trans women. Services were said to be sometimes unsafe, for example, public transportation and shelters. Transportation to doctor's appointments and elsewhere were considered unsafe, inconvenient, expensive, and otherwise difficult. Transportation through medical insurance or agencies were unreliable, unsafe, or practiced some type of discriminatory process for trans women. Public buses are unsafe due to stigma and violence. Some issues with employment include unemployment effects are issues such as housing, transportation, insurance, medical, and mental health services, and safety. Many experience employment discrimination, harassment, or disrespect at work. It's hard to find or keep work that provides a living wage. Unemployment can lead to sex work, which increases risk of physical and emotional violence. One of the other concerns included housing. It's difficult to find affordable, stable, and safe housing. Housing services such as shelters and other programs often are inadequate and unsafe. You can't access women's shelters if identified documents lack female gender marker. Harassment and sexual harassment and violence are often given at men's shelters. Some of the other concerns included social isolation. Stay home to avoid violence or harassment is what one of the young ladies said. They want supportive and they want to be connected to the community. Community and peer support should be more available for younger trans women. No support for trans women who have aged out of youth-serving agencies. Then we want to tap into HIV care. Participants were receiving HIV care and have been to an HIV doctor in the past 3 months. Positive experiences were actually reported with the HIV care providers, so we're happy about that. Most felt comfortable disclosing that they were trans women to their HIV providers. Challenges switching from providers who specialize in working with younger trans women to providers who work with older clients is an issue. Anxiety and disappointment when exceeded the age limit and needed to change providers is often experienced. Possessing HIV medication could disclose HIV status, especially if carrying those medications because of no stable housing. Some concerns were also about the interaction between HIV medications and other medications, and just the cost of the HIV medications. So let's take a closer look at some of the top barriers that were included. Scared of discrimination based on gender identity, uncomfortable with body being examined, and couldn't afford the needed health care, and insurance doesn't cover all of the needs, such as hormones, and we know that there are lots of other issues and things that our insurance does not cover. This study was actually done by the Michigan Trans Health Survey, so if you want the full information regarding that survey, we can also include that in our YouTube channel. Some of the other issues included cultural competency. Some receive cultural competence services from HIV care and other providers. Stigmatizing or difficult experiences in healthcare, misgendered often by providers, more likely to be misgendered when identity documents lack correct gender marker, and changing gender marker is difficult due to the expense and just bureaucratic relations or restrictions. Some issues also include insurance, expensive insurance, co-pays for medication, including HIV medication, changes in insurance coverage or interruptions to medical care related to unstable employment or being released from incarceration. Challenges with insurance, including Medicaid programs not covering hormone therapy and body modification. Another identified issue included mental health care. Challenges receiving quality mental health care due to lack of skilled or culturally competent providers. Also, inconvenient office hours and locations were made worse by transportation challenges. So some of SEMHAC possible solutions were, we want to work with finding employment, housing, transportation, advocacy to address medical and legal issues, peer support, quality, cultural competent care, representation, outreach, and community engagement. This is one of the other things that we want to tackle with our needs assessment. We do have a survey for the trans community as well as youth. We want to try to figure out, what do you know about SEMHAC and how can we get you to be a part of SEMHAC, because we want all of the populations and all of the bodies that we serve to be present, because who can advocate better for you than you? So we want to make sure that you follow our survey. If you want more information on how to complete that survey, you can go to the SEMHAC webpage and you have access to all of the information there. And that would conclude the information regarding our transgender survey. We are working with different communities or different agencies in the community to try to make sure that we can address and tackle some of these issues that were identified. We want to look into some of the ending the epidemic dollars and try to see if we can use some of that specifically for the trans population, because we want to make sure that everyone feels safe in the DEMA. Thank you.